What is going on, gangers? Brother Namdi back at your service, and I'm here to dive into a continuous series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 4 of this series, we are going to dive into a fictional character that people may or may not know, and his name is Goku from the Dragon Ball series. I decided to use myocarditis to describe Goku's illness. But first, let's dive into what myocarditis is. Myocarditis is basically swelling or inflammation of the heart muscle. And when there's inflammation on the heart muscle, it makes it harder to pump out blood. This can be caused by specifically viruses, and that will tie into Goku, because as you know, he had a heart virus in the DBZ series. Yes, there are other ways to develop myocarditis, but for this video, we are only focusing on viruses. Before I continue, let me give you guys a theory. I believe Goku developed this heart virus because of the Kaioken. Because initially he was not supposed to use it that many times. He kept trying to push his limits. And King Kai warned him not to go past Kaioken times 2, but Goku did not listen to that. But anyways, risk factors to developing myocarditis would be the following: untreated strep throat, Lyme disease, HIV or AIDS, immune diseases, and even bad oral hygiene, because it can travel down the heart. Now let's dive into signs and symptoms of myocarditis. Symptoms can include chest pain, shortness of breath, fast or abnormal heartbeat, swelling of the feet or hands, and general fatigue. Tying this back to Goku, he had chest pain, obviously. He had shortness of breath, he could barely stay in Super Saiyan form. He had fatigue, he was heavily breathing and could barely stand up. And most likely he had an abnormal heartbeat. Now, how do we diagnose myocarditis? A few things we could do. First, a chest x-ray would show an enlarged heart. Now, if you wanted to do an EKG, things to look out for would be higher T-wave inversions, and also saddle-shaped ST elevations. Blood tests would be possible, and you would look out for elevated troponin and elevated creatinine kinase. Now, the main diagnosis to figure this out would be a tissue biopsy of the heart, but it could be lethal and risky. Now, I ain't never seen Goku and company go to a hospital or whatnot, but I'm not sure what diagnosis they would take. But I'm just giving them their options now. Now, how will we treat myocarditis? Let's dive into that. It all depends on what type it is. If it's viral, most likely we'll let it heal on its own. If it's bacterial, we will give antibiotics to correct the cause. Now, in the more serious cases, we may have to do a heart transplant surgery, unfortunately. Myocarditis could lead to things like fibrosis, which is scarring of the heart, and or heart failure. As always, I use this series to highlight health conditions that people may be going through. If you are going through any of these medical conditions, please seek help and know that you matter. Fictional characters are used to give a more creative and different perspective on the situation. If you can appreciate this video, please like, comment, subscribe. If you haven't already, please check out the previous 3 parts to this series. And if you have a suggestion for a condition or character for part 5 of this series, please put your comment down below. But if nothing else, y'all take it easy.